uh, we need to be thinking about how we're going to deal with issues of contact tracing, testing, and once there's a vaccine, vaccine delivery. Currently, multiple governments and privately owned and pharmaceutical companies are racing to get the first COVID-19 vaccine out as scientifically possible. With a rush order in place, it is expected that multiple vaccines will ultimately be approved, but none will be widely available to the public for 12 to 18 months. When available, it is likely that they may have different storage, transport, and inoculation requirements. I would add some of these vaccines need really, really super cold chains, like something like minus 70 degrees Fahrenheit. And how we're going to figure that out is going to be a technology and an engineering and logistics feat. Given the challenges involved in the absence of a vaccine, the wait time should be spent by the development community, most importantly, on what needs to be done now. So masks, diagnostic, and contract tracing to minimize the impact of the pandemic, and on making sure we have the logistics plans to deliver the vaccines if and when it's available. I'm really grateful that some old friends of mine and some new friends of mine are here to help us really unpack this complex set of challenges. I've been arguing that COVID is a disruptor of economies and society, an accelerator of things like digital transformation, and a clarifier, I think, of some geostrategic challenges that we have, among many other things. I'm really grateful to have Dennis Carroll, who many of you know. He's a globally renowned pandemic expert and is currently the senior advisor for global health security at URC. Dennis previously served as the director of the USAID's Pandemic, Influenza, and Other Emerging Threats Unit. He's someone widely respected in the global health field. So let me start with Dennis. Dennis, we're now 10 months into the COVID-19 pandemic, entering the winter season with record-breaking surges in reported cases. Was this situation of both the surge and lockdowns, were these inevitable?
Well, Dan, first off, thank you for the opportunity to participate in this discussion, and look forward to this. It's going to be very, very fun, I think, in a very unfun time, obviously. Look, the current surge was more than predictable. I mean, we've been saying since the spring, in all likelihood, this respiratory virus really favored cold, dry weather. If we go back to the spring and we talked about flattening the curve, doing the lockdowns, all of that was because we did not really have a comprehensive toolbox, and we didn't really understand the virus as well as we needed to. And those were really emergency measures to protect the health system, to ensure that those normative services that the health system provides were not compromised by this pandemic. But it meant it was it gave us a period of time to prepare for what was the inevitable winter surge. And that preparation meant that we really had to step up, both nationally and globally, the making available what we know are the critical tools to be able to really stop this virus and control it. And that is readily available rapid diagnostics linked to contact tracing. Think of it in military terms. This is the core intelligence that tells you where your enemy is. The virus is our enemy. And lockdowns are a blunt instrument. When you don't really have an understanding of where the virus is, you have to shut down everything. Diagnostics and contact tracing tell us where it is, and it allows us to be much more surgical. Unfortunately, we're largely dealing with the same technologies that we had 6 months ago. We did not have a Operation Warp Speed for diagnostics. It was not the US government stepping forward and really incentivizing, making available the equivalent of an early pregnancy test that every household could have available, and a really significant investment in the ability to utilize that information for contact tracing. It's all about knowing where the virus is, isolate it, and eliminate it.